Welcome back to Health Hash, your go to channel for all things health and wellness. Today, we are diving into two fascinating conditions that often get mixed up: Graves' disease and Plummer's disease. But before we get into the details, let's set the stage with a real life scenario to bring these conditions to life. Alright, picture this. A 31-year-old woman walks into the clinic. She's a laborer and she's got this lump in the lower front part of her neck. It's been hanging around for 2 years now, slowly getting bigger. Here's the thing, it doesn't hurt, but when she swallows, it moves. Kind of intriguing, right? Now, here's where it gets even more interesting. She's also showing signs of hyperthyroidism. Think rapid heartbeat, weight loss, and that jittery nervous energy. But here's the kicker, there are no sign of compression or anything that screams malignancy. So, what could this be? The first thing that comes to mind is Graves' disease. But hey, we are not stopping there because we gotta keep an open mind. Plummer's disease, for example, is still in the running. Curious to know what's going on here? Stick around because we are diving into this fascinating case. Before we jump into the nitty gritty of symptoms and pathology, we need to understand the basics. What are Graves' disease and Plummer's disease? Alright, before we dive deeper, let's make sure we are on the same page with two important terms: thyrotoxicosis and hyperthyroidism. These are often used interchangeably, but they have some subtle differences. First, let's talk about thyrotoxicosis. This refers to the signs and symptoms you see when the metabolic rate and sympathetic activity are cranked up due to elevated levels of thyroid hormones. It's like your body is in overdrive. Rapid heartbeat, sweating, and weight loss are just a few of the things that can happen when you're dealing with the thyrotoxicosis. Now, hypothyroidism. This one's a bit more specific. Hyperthyroidism is the actual condition where the thyroid gland becomes overactive and starts producing too many thyroid hormones. So, hyperthyroidism is what's causing the thyrotoxicosis, but they aren't quite the same thing. Think of thyrotoxicosis as the symptoms and hypothyroidism as the condition itself. Hope that's clear things up. Let's keep going from here and dig deeper into these conditions. Did you know that thyrotoxicosis or hypothyroidism can happen at any age, but is way more common in women? In fact, women are about 8 times more likely to be affected than men. So, why is that? Here's a fascinating reason. Women have estrogen receptors in their thyroid glands. Yes, you heard that right. These receptors can be activated by estrogen, and that stimulation can play a role in triggering hypothyroidism. Pretty amazing, isn't it? It's just another way the human body keeps surprising us. Alright, so what actually causes thyrotoxicosis? Well, we can break it down into two main categories: thyrotoxicosis with hypothyroidism and thyrotoxicosis without hypothyroidism. First, let's talk about thyrotoxicosis with hypothyroidism. In this case, the thyroid gland is overactive, meaning it's pumping out way too many hormones, which leads to thyrotoxicosis. Pretty straightforward, right? Now, on the flip side, we have thyrotoxicosis without hypothyroidism. Here, the thyroid gland isn't overactive at all. Instead, this could happen due to things like external intake of thyroid hormones or, believe it or not, ovarian tumors that have thyroid tissue in them. Crazy, right? But we are not diving too deep into all the causes today. That's a whole video on its own. For now, let's zoom in on two key players, Graves' disease and Plummer's disease. Both of these are major causes of thyrotoxicosis with hyperthyroidism. And trust me, they're pretty fascinating. So let's explore them in more detail. All right, now let's break down the differences between Graves' disease and Plummer's disease one by one. We'll cover the key aspects so you can spot the differences easily. First up, the cause. In Graves' disease, the culprit is thyroid stimulating immunoglobulins or TSI. These are IgG antibodies that actually stimulate the thyroid gland, causing it to enlarge and produce way too many hormones. On the other hand, Plummer's disease happens when one or more nodules in a long-standing multinodular goiter becomes overactive, leading to excessive hormone production. So Graves is all about those antibodies, and Plummer's is about those overactive nodules. Now let's talk demographics. Graves' disease tends to show up in young women, usually between the ages of 20 and 40. It also has a pretty strong family history in a lot of cases. Plummer's disease, on the other hand, is more common in middle aged or older women. So you can see the differences in age groups here. Next, the onset. Graves' disease can have a sudden or gradual onset, meaning it can hit fast or slowly creep up. But when it comes to Plummer's disease, the onset is typically gradual and tends to happen later in life. So Graves might surprise you, but Plummer's takes its time. Let's move on to the symptoms. In Graves' disease, you'll see some pretty distinct signs. For example, eye issues like bulging eyes and infiltrative ophthalmopathy, which could mean dry eyes, excessive tearing, lid lag, and blurry vision. There are also hypermetabolic symptoms like weight loss, increased appetite, and excessive sweating. In some cases, thyroid dermopathy can show up too, although not in everyone. Now, with Plummer's disease, the symptoms are a bit different. You might see cardiovascular signs like palpitation or even atrial fibrillation. Heart related symptoms are actually pretty rare in Graves' disease, so this is a big differentiator. And unlike Graves, you usually won't see the eye signs or thyroid dermopathy in Plummer's disease. So, as you can see, while both conditions share the common theme of excessive thyroid hormone production, they have the unique causes, patterns, and symptoms. To wrap things up, Graves' disease and Plummer's disease are both major causes of thyrotoxicosis with hyperthyroidism. But they stand apart in terms of their causes, the people they affect, their symptoms, and how they present. Now, let's go back to our clinical case. Considering the patient's age, medical history, and symptoms, Graves' disease seemed to be the most likely diagnosis. But don't forget, Plummer's disease is still an important condition to keep in mind, especially in older patients. Thank you so much for watching. If you found this video helpful, make sure to give it a thumbs up. Don't forget to subscribe to help Hush and turn on that notification bell so you'll always be updated when we post new content. And I would love to hear from you. Drop your questions or thoughts in the comments below and let's keep the conversation going. Until next time, stay healthy and stay informed.